What if I told you there are surgeons who operate on blood vessels smaller than a single strand of your hair? Well, today we're diving deep into that world, journeying to the absolute edge of medical science, into a realm of surgery that happens way beyond what our eyes can see. It really begs the question, right? How in the world do you fix something that's practically invisible? How do you reconnect the body's most delicate plumbing and wiring? Well, the answer lies in a field so precise, it honestly sounds like something straight out of science fiction. So to really get our heads around this, we first have to understand the incredible scale we're talking about. This isn't just your standard microsurgery. We're talking about a whole other level of precision. And it's that incredible precision that's unlocking treatments for conditions once thought to be completely hopeless. And this right here shows you just how big of a leap we're talking about. Look, microsurgery is already this incredibly delicate art, dealing with vessels that are maybe 1 to 3 millimeters wide. But super microsurgery, we're going even smaller, targeting vessels that are less than 0.8 millimeters. To put that in perspective, we're talking about repairing things that are thinner than the lead in a mechanical pencil. It's just astounding. So why do we even need to be that precise? Let's take a look at a condition called lymphedema. The easiest way to think about it is like a massive, non-stop traffic jam happening inside your own body. You see, your lymphatic system is basically this huge fluid highway that clears waste from all your tissues. But when there's a blockage on that highway, which can often happen after cancer treatment, that fluid has nowhere to go. It just backs up and up, causing this chronic, painful traffic jam right under your skin. And trust me, this is way more than just a little swelling. The constant pain and discomfort are just the start. Because the system is compromised, there's a much higher risk of infection from even the smallest cut. For patients, it's a constant daily battle. So the big question becomes, how do you clear this traffic jam for good?
And that is where supermicrosurgery comes in with a totally brilliant solution. It's not about trying to clear the roadblock itself, but about building a tiny, microscopic detour around it.
And there are pioneers all over the world leading this charge, like Dr. Zhang Yi in Shanghai. He and a huge team are performing these groundbreaking procedures, using techniques they learned from innovators like Professor Koshima in Japan.
The procedure is called lymphaticovenular anastomosis, or LVA for short. Now, anastomosis is just the fancy surgical word for connecting two tubes. So what surgeons do is they use a special dye to find a working lymphatic vessel, and then they find a tiny little vein nearby. Then, with just unbelievable precision, they stitch them together. They are literally rerouting the trapped fluid into the venous system, creating a brand new exit ramp on that blocked-up highway. And get this, the whole thing is done through an incision that's only 2 to 3 centimeters long. It's a life-changing operation performed through a cut that's smaller than your thumb. Just incredible. And the results? Well, they can be absolutely profound. Take this case, for example. A 28-year-old who had suffered from a severe lymphatic condition their entire life. After an LVA procedure, they saw a massive improvement. So this isn't just theory, right? This is a proven success that is completely transforming people's lives. But super microsurgery isn't just for plumbing problems. The exact same principles are being used to tackle another huge challenge, nerve repair. So if lymphedema is like fixing tiny pipes, this is like trying to rewire a frayed electrical cable that's thinner than a piece of thread. For decades, one surgeon, Isao Koshima, has been at the very forefront of this field. He's been developing techniques to reconnect the body's communication lines and restore function after some truly devastating injuries. And this timeline just shows the amazing evolution of his work. It's been a 40-year journey from the earliest microsurgery all the way to these highly advanced nerve grafts that can bridge huge gaps in a damaged nerve. It's a story of just relentless innovation. And this right here highlights one of the biggest breakthroughs. A standard nerve graft, well, it's kind of like a simple patch that has to rely on the area around it for a blood supply. But a vascularized graft, that's a living piece of tissue that's transplanted with its own artery and vein. It literally brings its own life support system with it, and that makes all the difference. And what a difference it is. A standard graft can maybe bridge a gap of about 6 to 8 centimeters, but a vascularized graft can repair a gap of up to 30 centimeters. That's not just an improvement. That's the difference between a minor repair and being able to reconstruct a huge section of a major nerve. It completely changes what's possible. So after seeing all these unbelievable advances in fixing the body's plumbing and wiring, you've got to ask yourself, what's next? I mean, where does this incredible frontier of medicine go from here?
Well, the future is all about pushing that precision even further. Just imagine nano-micro instruments for even finer control, surgical robots that can cancel out the tiniest hand tremor, or even lasers that can seamlessly weld these little vessels together. And the focus is also shifting to prevention, getting in there and fixing things before major damage ever happens.
But, progress always requires caution. As the pioneer Isao Koshima himself points out, these new technologies, like lasers, they come with their own risks. Innovation isn't just about charging forward, it's about moving forward safely and making sure your solution doesn't accidentally create a whole new problem.
And that really brings us to our final question. We've seen surgeons repair systems on a scale that was once thought to be completely untouchable. So, as the tools get smaller and the techniques get even better, what's the next frontier they're going to conquer? What does the future of medicine look like when a surgeon's best work is literally too small to see?